Resolution and Compensation After Medical Injury by Dr. Kenneth Sands, in collaboration with the Institute for Professionalism in Ethical Practice.
Hi, I'm Ken Sands, Chief Quality Officer at Beth Israel Deaconess Medical Center in Boston, and also speaking to you today as a member of the Massachusetts Alliance for Communication and Resolution Following Medical Injury, also known as MACRME. MACRME was formed to support institutions that are adopting a more transparent and proactive approach to engaging with patients after an adverse event. These programs have been termed by some as disclosure and apology, but at MACRME we prefer the term communication and resolution, which we think better emphasizes the true meaning of these conversations. Whatever the name, the aim is to move away from an adversarial model to one that is seen as fair, transparent, and supportive. Today, my focus is on the specific issue of when resolution involves actual compensation. It is important to note that resolution is not the same as compensation. For patients, resolution often means assuring the patient that the institution has addressed the root cause of the adverse event and has taken steps to prevent future patient harm. If it is deemed by the institution that financial compensation will potentially be part of the proactive resolution, our first step is to describe to the patient that we would like to make an assessment of the financial impact of their loss and that we need their permission to do so. We say that the findings will be discussed at a follow-up meeting. We encourage patients to have legal representation as part of these discussions as the best way to ensure complete and legitimate negotiation where the patient is assured of a knowledgeable advocate. However, we do not require patients to have legal representation in order to move forward. For the assessment itself, we'd recommend working closely with the insurance arm of the institution, as this is the group with the professional resources to objectively determine the financial impact of a loss. At some institutions, the insurance arm will be part of the institution itself. For others, it may be a separate institution, but working with these together is important. During the meeting with the patient and their representatives, the goal is to agree on a resolution that is complete and enduring. Thus, if compensation is agreed upon and accepted, the patient is asked to sign a release recognizing that the issue is satisfactorily resolved. In Massachusetts, the institutions participating in a formal pilot of communication and resolution approach are finding that early resolution, including compensation, is achievable and is satisfying to both patients and providers.
Reflective exercise. Please post your responses on the comments board for this video so that others may learn from them.